Bronchitis is defined as an inflammation and obstruction of the bronchioles. It can be acute or chronic. However, we are focusing on chronic bronchitis. Chronic bronchitis is characterized by a history of chronic productive cough for at least 3 consecutive months over 2 consecutive years and swollen mucous membranes.
This is James. James is a 59-year-old male who has heavily smoked for the last 30 years. He worked for 25 years in the coal mines and now resides in New York. Bronchitis can affect any individual, but one's chances are increased by lifestyle actions such as smoking for long periods. Harsh working conditions where the individual is exposed to excess irritants such as smoke, pollution, and smog can also contribute. One is more likely to get bronchitis if they already have asthma and airway hyperresponsiveness. There is also a genetic component, hereditary deficiency in alpha-1 antitrypsin.
James has been diagnosed with bronchitis. Persons with chronic bronchitis are known as blue bloaters. This name comes from the blue tinge of their skin caused by lack of oxygen and bloating because of difficulty inhaling and exhaling. Other symptoms include a cough, sputum, fatigue, and shortness of breath.
The lungs branch off into smaller segments starting at the trachea, then bifurcating into the bronchus, then branch into the bronchioles, and then the alveoli. These smaller segments play a role in gas exchange. Now we will take a closer look into the bronchiole. Bronchitis mainly affects the bronchioles. Each bronchiole is surrounded by smooth muscle. As the body breathes in irritants, normally the mucus, represented here by green objects, lines the bronchioles and traps the irritants. Then they can be destroyed through phagocytosis, or they can be expelled through coughing via smooth muscle contraction. Cilia waft the mucus up and out of the lungs. This is completely normal within the body.
In James, who has bronchitis, when irritants enter the bronchioles, there's an overproduction of mucus, which clogs and narrows the lumen, or the inside space of the tubular structures of the bronchioles. Irritants trigger immune cells, such as mast cells, to release histamine, which causes inflammation of the bronchioles. Changes in the mucous membrane occur, and neutrophils infiltrate the submucosa, which also contribute to inflammation. This causes an overproduction of sticky mucus. The goblet cells, represented by the blue squares, which produce mucus, increase in number due to the increased need for mucus. The bronchioles are normally sterile, but are now occupied by bacteria and debris that is hard to expel from the body. This causes smooth muscle spasms or contractions in order to try to rid the body of this sticky mucus, which presents in the form of a barking cough. Smooth muscle contraction is caused by prostaglandins and thromboxane, which are cell membrane phospholipids. The bronchial wall is eventually damaged and scarred, which results in a thickening and stiffening of the wall.
To understand the treatment, we are going to take a closer look at the receptors. Normally, acetylcholine binds to the cholinergic receptors which cause bronchial constriction. Because of the narrowing of the bronchiole, bronchodilators are used to treat and widen the lumen. Bronchodilators, including anticholinergic agents, inhibit the normal parasympathetic response of bronchoconstriction. They prevent acetylcholine from binding to cholinergic receptors. Therefore, the bronchioles stay dilated. In severe cases, oxygen therapy is also prescribed in order to ensure the individual is getting adequate oxygen supply. Another simple way to control the cough is to use a vaporizer in order to help suppress the cough reflex.
James can undergo all of these treatments in order to properly cope with his chronic bronchitis. He will never fully recover because of the damage that has been done to his lungs, but he can manage his symptoms and live a full life.
The mucous membranes within the bronchioles become swollen and inflamed because of the presence of neutrophils. Cholinergic receptors are found in the smooth muscle membrane. These normally cause the parasympathetic response of bronchoconstriction.
An increased number of goblet cells produce abnormal levels of mucus which alters homeostatic levels in the bronchioles. Inflammation in the bronchioles is caused by neutrophils, which are present in response to the bacteria and irritants that are in the mucus. Homeostasis is also disrupted due to less air reaching the alveoli because the bronchioles are narrowed. This results in lower levels of gas exchange, therefore lower oxygen levels and higher CO2 levels. Respiratory acidosis occurs when the lungs can't remove enough carbon dioxide. The removal of the carbon dioxide by the respiratory system is less than the production of CO2 in the tissues. Excess carbon dioxide makes the blood more acidic. Chronic respiratory acidosis develops over time. It does not cause symptoms. Instead, the body adapts to the increased acidity. For example, the kidneys produce more bicarbonate to help maintain homeostasis in the body.
Proteins involved in bronchitis are cholinergic receptor proteins. The cholinergic receptors play a role in bronchoconstriction and are inhibited by anticholinergic agents during treatment.
Bronchitis is the inflammation and obstruction of the bronchioles. Narrowing of the bronchioles is caused by excess mucus due to increased number of goblet cells. Histamine causes an inflammatory response due to bacteria and debris caught in the lungs. Smooth muscle contraction caused by cell membrane phospholipids causes coughing in an attempt to expel the mucus.